Hi, I'm Dr. Katey Nicolai. I'm the Director of Clinical Care at June Care, which is a teletherapy company aimed at providing personalized, evidence-based, high-quality care. And today I'm here to answer your questions about mental health and therapy. So the first question that I have is, what do you do when you can't find a reason that you're sad and there's no clear solution? So it sounds like what that person may be struggling with are some symptoms of depression. And the first thing that I want to put out there is that mental illness is probably more common than most of us realize. Up to 20% of adults can experience an episode of depression or some other mental illness within a given year, according to the World Health Organization. So if you're struggling with feelings like this, the first thing to know is that you're not alone. You're not the only one struggling with these kinds of things. And so if you are struggling with feelings of sadness that just don't go away and seem to not have a very good explanation, and it seems like it's getting in the way of your day-to-day life, my first recommendation would be to talk to someone about that. Whether that someone in your life is a trusted friend, but probably even better, a licensed professional counselor. Counseling is not as intimidating as everyone might fear it might be if you've never tried it before. For every type of personality out there, there is a counselor to go along with it. And so looking into counseling is something that might really help you find practical day-to-day solutions for coping with those feelings of sadness and depression so that you don't have to go on experiencing them anymore. So go ahead and try looking for a counselor, find someone to talk to about that sadness, and you may be surprised at how quickly you can find some solutions for it. The next question that I have, how can I help depression caused by seasonal gloomy weather? That's a great question, especially for where I live here in the Pacific Northwest. We often have long, dark, cold, gloomy winters here. So when someone comes to talk to me about seasonal depression or seasonal anxiety, and they find that it's really anchored to the darkness, usually the first recommendation I make for those folks is to take a look at your day-to-day routine and see if it changes at all when it's winter time, when it's darker out. Do you notice that you're going to bed earlier, sleeping in later, for example? Has your sleep schedule changed a lot? Because a lot of seasonal depression research is finding it can also be linked to things like circadian rhythms. And so sometimes making an adjustment to your sleep schedule can help with that. But another really good recommendation that I make for almost all my clients who struggle with seasonal depression is to make time every day, usually best first thing in the morning, to try and get some outside time. For some folks, that might be as simple as standing next to an open window while you have that first cup of coffee, looking up at the sky, which is lightening, even if it's darker than normal, and really letting yourself kind of absorb that outside light, bright experience. It's even better if you can actually step outside for a moment. Even if you live in a busy place like I do, sometimes there's a little balcony that you can step onto for a moment, walk outside your apartment or walk outside your house. Bundle up if it's cold, bring your umbrella if it's raining, and try to give yourself at least a couple of minutes of outdoor time. Those are some initial tips for coping with seasonal depression. And if you find that it's significant enough to be impacting your day-to-day life and work, then I really encourage you to reach out and get some support from counseling because they can find more personalized tips for you. The next question that I have on my list here, what's the best advice for dealing with anxiety and panic when you're in public? So all of us might be willing to try some new things to cope with anxiety when we're in the safety of our own home and no one's around to judge us. But sometimes anxiety can be a lot worse when we are at work, at school, someplace outdoors where it feels like other people are watching us. In fact, that can even be some of the source of anxiety. And so there's a couple of quick tips that I have to coping with anxiety in public. And these are things that you can do so subtly that no one around you will really notice that they're happening. So the first tip is to pay attention to your rate of breathing. It sounds really simple, and maybe if you've had anxiety, you've heard people recommend deep breathing to you before, but it's actually a really easy skill to practice that can actually impact the physiological mechanisms that are having an impact on your anxiety, that are elevating your conscious anxiety via signals that your body is sending. So the first thing that I recommend that people do is place a hand on their abdomen so that they can feel their rate of breathing and connect to their body a little bit more deeply. And this is something that you can kind of casually do in public, even if other people are around, and no one will probably notice you placing your hand here or make anything of it. And then to just pay attention to your rate of breathing. Do you notice that it's faster than normal? Do you notice that your heart rate is increased? And then try for the next couple of minutes to slow down that pace of breathing, to fully inflate your abdomen with air, and then exhale deeply. I'm doing it audibly now to demo it to you, but there's no reason this needs to be audible when you're in public. If you're standing in line at the grocery store getting nervous about what's going to happen next, placing your hand on your abdomen and engaging in quiet, deep breathing can work to lower that anxiety. Another quick tip that I often give people for panic is doing a little bit of a grounding exercise. Grounding is a complicated topic that you can talk about more in therapy if you feel like it applies to you, but one quick tip that I can give you today is using a rule of 5 grounding technique that I teach to lots of my clients. So if you're sitting somewhere or you're out in public, the first thing that I'll have you do is actually just make contact with your own hand and start to notice and observe 5 things in the room around you. And as you go down that list of 5 things, to actually touch the fingers on your hand to, again, pull yourself back into your own body and re-ground you in the present moment. So for example, if I'm sitting in the room around me right now and I'm going to do this grounding activity, I might touch my thumb first and say, okay, I notice my kid's toys piled up in the corner, and I'll note the colors to myself. I notice my plant hanging from the wall. It needs a little bit of water. I notice that the refrigerator door is ajar. Again, I'm doing this audibly so that you guys can see it demoed for you, but there's no reason you can't do this internally, mentally as well. And again, the movements are so subtle and small that no one around you is going to notice you engaging in these things. So engaging in a little bit of deep breathing and then doing a little 5-point grounding exercise are 2 little tips for coping with anxiety in public that no one around you will likely notice. And again, if you find these things helpful or want to learn more about them, a good place to start doing that is in therapy. Your therapist can help tailor these tools to make it more useful for you. And I'm going to answer one more question. The last question I have: even when I'm tired, I can't sleep at night from anxiety. What do I do? We've already talked a little bit about sleep and the connection to anxiety and circadian rhythms. The first step in getting into a better routine and sleep schedule is to note down what that routine even is. And that's the first thing that your counselor or your therapist will help you with when you go to meet with them. They'll have you keep a little bit of a sleep log or a sleep diary so that you can actually make notes. What time are you going to bed? How frequently are you getting up? That'll give us more insight into the real nature of the sleep problem that you're struggling with. 2 little tips though, if you are hoping to address your sleep problems right now in the moment. The first one is to keep a worry log on your bedside table. If you feel like it's anxiety and racing thoughts that are preventing you from going to bed at night, one helpful thing you can try is writing out a list of all of those worries in that little notebook that you keep next to your bed, and then mentally telling yourself you're going to let those worries go. You've recorded them and they can wait until tomorrow now because you're not going to forget about any of them, and give yourself permission to release those thoughts from your mind so that you have a chance to go to sleep. Anytime they start to crop back up, you just remind yourself, I wrote them down, I can let it go for tonight. Another helpful sleep tip is to get into a pre-bedtime routine that starts to signal to your brain that it's time to wind down and go to sleep. A lot of us are in the habit of scrolling on our phones before we go to bed at night, but the light and the activity that comes along with scrolling, even if it feels relaxing in the moment, actually tells our brains that it's time to wake up and do stuff. So I recommend putting aside your phone at least an hour before bedtime and then winding down to bedtime with some relaxing activities, or even something mundane, brushing your teeth, reading a chapter of a book, laying in bed peacefully for a little while and engaging in deep breathing. These are all great strategies for helping your brain to wind down and go to sleep at night. Those are all of the questions that I have on the agenda for today. Of course, if you have more questions, feel free to reach out to me at June Care, and I look forward to talking with you guys again.